Hello, guys. Welcome again to Biobarica Talks. This is the space dedicated to the hyperbaric medicine. And this occasion, we're pleased to introduce special doctor, the quiropráctor Christian Pepitone. Hi, Chris. How are you?
I'm well. How are you?
Great. Thank you. So he's the founder of Pure Health. It's a medical center basically specialized on treating muscle, bones, pathology, sports medicine, among others. So we're going to talk with you about the experience with the hyperbaric chamber. I know you got you incorporated the hyperbaric oxygen therapy pretty much recently. So my first question, Chris, is what is your professional training and what does Pure Health mean to you?
All right. So my professional training, I'm trained traditionally as a chiropractor. I specialize in a technique called sacrooccipital technique. It's a blend of osteopathy and chiropractic, where I do craniopathy, organ manipulation, as well as any type of extremity work, including soft tissue manipulation. I also mix in anything that I can learn that can help people get better faster. So I do cupping. I usually do cupping with movement. Also gua sha. I have shockwave therapy in my office. I do physical therapy. I usually put together like at-home physical therapy programs for people just to upkeep and help maintain adjustments, and any of that kind of work. The hyperbaric I got just about a year ago. It's been an absolutely phenomenal adjunct to my office, which actually led me into. I'm actually in the process of a rebrand right now, where the new business is more based on longevity evolution. So it's going to be Pure Longevity Evolution Center. And the concepts are basically utilizing adaptive physiology to stimulate different rejuvenating processes in the body. And then you can help overcome disease, heal faster, and just be healthier and lower inflammation.
Great. So you mentioned that you I heard many others therapeutic options, services. Also, you're saying that you want to rebrand your center and everything. So your focus is pretty much integrative medicine, right? So how was your first approach in terms of the hyperbaric oxygen therapy, and how did you integrate this with the rest of your services or practices?
Well, the hyperbaric oxygen therapy really started me on the process. I got it really for me, to be honest with you, and my family. Just because, I read the data on the longevity, reversing biological age, what it can do for your mitochondria, rate of healing, increasing stem cell production, just overall energy, and reversing biological age through lengthening of the telomeres. So I got that for me, but then I figured, if it's good enough for me, it should be great enough for everybody else. So then I started offering it to all my patients. So with that, not as many people are using it for really, it's more for time, because of time, but for orthopedic concerns. And unless it's post-surgery, when I'm seeing it more with patients that are using it is with Lyme disease, a type of bacterial infections that aren't responding to antibiotics that usually due to biofilm formation, and then also for longevity purposes or chronic inflammation. So that's where I'm usually primarily doing that.
Good. And do you find kind of synergy between those practices and the hyperbaric oxygen therapy so far? So, do you have patients that you started with something and then you combine this with the hyperbarics and you see, oh, it's going faster with this, or I see different results?
There's not as many mixing and matching from like I said, the orthopedic standpoint. It's more like if I'm getting someone that has like Lyme's, that's has other also orthopedic conditions, and I educate them on the benefits of HBOT, then they end up transitioning into it and then utilizing it, and you see, absolutely phenomenal results with it. It's not really that long. It just depends on the conditions. That's how many sessions they would need, and then the frequency and whatnot.
And so far, what are the conditions that you're treating mostly with the hyperbaric chamber now? And do you have a specific case that you want to share with us, that just got you pretty amazed or surprised because
Sure.
of the
Autoimmune conditions, post-surgical healing, poor wound healing in general has been really helpful for them. I had one case where it was a chronic bronchial infection which was non-responsive. She was also a fairly difficult patient because, usually you say, like, 3 times a week, because 3 to 4 sessions for the physiology shift to kick in. And she was unwilling. She was like, absolutely not. I'm doing once a week. That's it. And I was like, okay, well, the data is that here's the data, but it's obviously your choice. So for her, it took 8 weeks or eight sessions for her to say, basically, my whole body aches. Is that normal? And I'm like, well, finally we got the cytokine production from the die-off. So yes, that is a normal process. If you're not comfortable with it, we could basically hold off on the hyperbaric for just a week or so, get you into an infrared sauna to help start stimulating more die-off of the bacteria. And then we can get you back in the hyperbaric so that we can ramp up the immune response even more and then finish it off. And she was like, nope, I'm good. I just wanted to know if it was normal or not. So by 10 sessions, she was fully resolved.
Wow, great. And what about healthy patients? I mean, maintenance, wellness, or this kind of purpose? Do you have some patients for this, or only?
Yes, I do. So this is where, like, the more of the longevity evolution stuff that I'm tying into now, where basically the goal is to reverse biological age, basically enhance stress resistance and stress resilience. So that's basically stress resistance is how much stress can your body tolerate before it has to actually react. Right. So it's kind of like acclimation. So if you think like ice baths, when you first go in, first 5 seconds is absolutely brutal and people want to jump out immediately. The more you do it, you can sit in there 5, 6, 7 minutes or even longer and not really feel much, right? Because you've got acclimated to that. Then there's the stress resilience perspective, right? So that's basically now you've stimulated enough stress on the body that it has to adapt. How fast can they rebound from that stressor? And then not only that, but with that stress resilience, when you rebound, you stimulate the adaptive responses in the body, and then the systems actually start to rejuvenate, the ones that are affected based upon the stressor. And this is where hyperbaric's been phenomenal because, I mean, it's a near full system, like almost every system in the body is affected by this.
Yeah.
And that's the cool part about, like, when you're seeing the outcome. So most of my patients that have been using it, whether it be post-surgery or really for anything, or even like the health and wellness and just longevity purposes or health span, really, everyone's saying the same exact thing where they're like, my friends are commenting on my skin. They're just saying I look so much better. What am I doing? And they're just saying, well, I'm just using hyperbaric. And really just the collagen production, the stem cell production. I mean, that's what you're going to get is better skin.
And I don't know in your case, but in my case, with my patients, when I see, I mean, they came for a specific diagnosis or a specific condition, and then found like the results and the benefits on the skin, hair. So it's impressive. What are you saying? I mean, it's so systemic. How the oxygen gets to all the tissues. It doesn't matter if you need it or not. Just the cells make their own metabolism and get the benefits of the hyperbaric oxygen therapy for sure. So, and how is that? I mean, in less work, how is the protocol of the longevity protocol that you already apply, or is gonna be on your new center? How is the pretty much the
For
protocol?
specifically hyperbaric?
Yeah.
Okay, so I base it off of the Israel study where it's 60 sessions at 3 times a week.
Okay, I was about to ask. I was similar to that. Okay.
Yeah. The one thing I'm kind of like still playing around with is like, can you do more without negating the benefit? Because part of with adaptive stress is that too much stressor, you become resilient, again, resistant to that stressor, and then your body stops reacting. So if you were to do this on a daily basis, there is a potential that you would not see that hormetic stress as much as if you were to do it, that 3 times a week regimen.
I mean, answering your question, remember that in this pressure, medium pressure, I mean, this is the advantage of the pressure, that you don't have this peak of stress. So that's why your body generates your own, response from that. So the peak of stress is not in this case. It's more after 2 or 3 atmospheres. So for sure, it's gonna be good. So, Doctor, the last question, and we are asking the same to all our guests here. So, if you have to define hyperbaric therapy or the HBOT in one word, what would be? Rejuvenating.
That would be a very easy one. Yeah.
Why? Just now you can explain it.
No problem. Well, so that's exactly what it does. I mean, ultimately, a lot of the markers, and there's so much more research that needs to be done, and it's in the process, I'm sure. But so far, like the markers that I've seen related to being younger versus older, it increases those markers. So stem cells, as we get older, they decline. Collagen, they decline. But when you go into hyperbaric oxygen therapy, they start to ramp up in production. So that in essence is getting your body to become younger, right? And not only that, but so that's like the concept is at that point is also is health span. So you don't want to just live longer and then be sick. You want to live longer and feel like you're 25 again, right? And that's really the goal of it. So it does rejuvenate your systems. I mean, it absolutely does. Increases new blood vessel formation anywhere that's poorly irrigated, you know, and I mean, all of that stuff. Circulation's huge. And reducing inflammation. I mean, we're fighting in industrialized worlds right now. The major problem is inflammation, chronic inflammation. So how to battle that, that's the key, right? And hyperbaric is one of the best ways to do that.
Well, nothing to add. Thank you so much, Dr. Chris, for your time, for your experience. It was a pleasure, actually. It was a real pleasure.
No problem. There is one more thing that I think that it's like that people should know, because this is I think this is an important thing about
Sure.
really just how breathing works, right? And why hyperbaric does exceed what your even potential is. So a lot of people think that oxygen is the only thing that's important in the body, and that CO2 is merely a waste product. But the challenge is like that if you don't have CO2 building up in your tissues because you're regularly dumping them out, the hemoglobin won't unbind the oxygen and then release it into the tissues. So you can have really well oxygenated blood in your bloodstream, in the vessels, but you can have poorly oxygenated blood tissues. And that's where a lot of problems tend to tie in. So when you have any type of breathing pattern dysfunction or disorder, and then people are like, oh, well, how's that going to help me? I'll just breathe. Well, no, you don't even have the ability to actually irrigate your tissues with oxygen. This is going to be able to get you way past that burden and overcome it in such an easy way, you know?
I agree. Totally agree. Well, thank you so much, Dr. Chris.
My pleasure. Well, thanks for having me.
And for you guys, I'll wait for you in the next episode. Remember that this episode and the next one is going to be on our platforms. So check it out and see you next time. Bye-bye.